give a very brief information about Professor Lepkowski. He's an emeritus professor at the Survey Methodology Program, University of Michigan Institute for Social Research. In addition to teaching sampling and estimation courses, he's among the authors of many scientific articles and books on survey research. We will ask him to draw a general frame for us today to help us understand how we should read the developments in survey research regarding the ongoing pandemic. Professor Lepkowski, to start off, we would like to ask you what the current developments imply for telephone interviewing. Although some surveys are already established as phone surveys and some are established as phone interview follow-ups, phone surveys may have to become the new face-to-face surveys in some cases. What are the implications of this?
Let's expand that a little bit, because you asked about telephone interviewing, and it's more complicated than that, because there are not only things that happen when you interview by telephone, but also how you reach subjects, people, by telephone, the sampling methods. So in the context of what I think you're talking about, many organizations around the world, government statistical agencies like your institute, they do things that involve face-to-face interviewing. Drawing a sample of households, that is housing units with people in them, and then going and interviewing people in those households in person, face-to-face. And with COVID-19, that has been restricted in countries throughout the world. The restrictions vary, but many agencies are finding this to be very difficult to deal with, because they don't want to endanger their subjects by possibly transmitting disease, nor do they want to endanger their employees who might be exposed to disease. So they're restricting, if not eliminating, the face-to-face interviewing. Well, as they do that interviewing portion, keeping in mind that the sample that they've selected is coming about through methods that are specific to households, housing units for sampling, they're stopping data collection. And this is a huge problem, because this eliminates important data that's being used for policy purposes around the world in individual countries and across countries. Many studies are done in the same way across countries so that they can be compared. And so this disrupts the understanding of what's happening at a particularly critical time. For example, if you're measuring things having to do with the economy, unemployment, or social well-being, how people are feeling in a time when they may be more socially isolated. The data is absent. The data is not there. The usual flow of data is not there. So turning to the telephone makes sense. It sets up the distance, right? Perfect social distance, right? You don't have to be 2 meters away or 1 meter away, depending on the restriction. It can be any distance away. But with the telephone, then two things happen. The sampling method changes and the interviewing method. The interviewing method being the most obvious, but so does the sampling method. But you can't use the same, typically, methods for sampling households over the phone that you do when doing them in person, because the in-person sampling involves physically looking at housing units as part of the process, typically, having lists of addresses. And those lists of addresses, when they're available, don't have phone numbers. So there's a disjuncture there, not only in terms of the interviewing, a change in interviewing, but also in terms of the sampling methods. So focus on the telephone interviewing for a moment. Telephone interviewing has been around for a long time. This is not new, but it's new for many of these agencies, these institutes, these organizations. They are not familiar with doing this. They've not done it before. And it raises all sorts of issues that raise questions about the apparent viability, the apparent ability of a researcher to use that method for data collection. So will people actually, when you call them on the phone, answer the questions we've been asking in the past, or new kinds of questions? Will they answer those questions in ways that we're going to get accurate responses? Will they, because it's a phone, rather than having a person in front of them, will they answer less seriously, or in some cases more seriously, the questions? So for example, if you've got someone calling whom you can't see but can only hear, are you likely to respond, let's say, less rigorously, less formally, casually to questions about things like the economy, unemployment, or income, or expenditures? Maybe you don't take it as seriously. You think they don't need as accurate a piece of information if they're calling by the phone. I mean, the phone is a personal communication device for many people. But there's also the issue of maybe the phone gives us better data in some cases. So for example, if we're asking about sensitive kinds of behavior, things that people do that, and this is going to vary from culture to culture, but things that people do that they're uncomfortable answering the question directly. Even if they had someone in front of them, they're uncomfortable. So it's a sensitive question and a sensitive answer, and both of those matter in this particular case. But because you're not looking directly at a person, you're only hearing the audio, does that give you more social distance, like we're talking about for prevention of transmission of disease? Does that provide a distance between you as the person answering the question and the person asking the question that gives them less discomfort question truthfully or accurately? And so there may be some questions about socially, let's say, desirable behaviors where maybe the telephone is better. Okay. Now, that's one class of problems. That's kind of a problem having to do with what we technically call measurement error. So the measurement process is that process. Ask the question and get the answer. And to the social scientist, that's how they measure. Other scientists do it differently, right? They're in laboratories. They're measuring through machines answer and answer process. And so are they answering the questions as well on the telephone as we can get them to answer face-to-face? Now, that's important because for many of these surveys, many of these questions, because they're continuing to ask the same questions over time. So if they've been asking face-to-face for a long time, and now all of a sudden they switch from a method where they've got one level of accuracy, one level of rigor, one level of quality response to another method that has a different level, then if they start measuring change over time, is the change real? Or is the change due to having switched the methods? Okay. Now, measurement is a part of that. And measurement error is a very rich, complex field. I wouldn't characterize it as one that we understand thoroughly, but we do understand it and have a lot of theories that have been proven to describe what people do when they answer questions in face-to-face settings and by telephone. And here's the key part. There have been comparisons over time of face-to-face interviewing and telephone interviewing. What would you do? You'd want to ask the same questions to equivalent groups of people and then see if you get the same answers on average. You can't ask somebody a question on the telephone and then go and ask them the question face-to-face, because as human beings, we remember these things and you get interference. So two groups of people, what do we get on average? Because that's what we're reporting anyway. When we report things like unemployment, it's the average level of employment. What fraction of people are employed or unemployed? So do those come out to be the same when you interview by phone or face-to-face? Or if you're asking attitudinal questions, their opinions about things, do you get the same level of opinion, same structure of opinion, the same kinds of answers in terms of their opinions by face-to-face and telephone? And these comparisons have shown largely that that is the case. There are not many differences between the answers you get by telephone and by face-to-face. There are some. There's a little bit of indication that the telephone could be a little bit better with socially desirable questions, but it's not dramatic. There's a little bit of indication that you might get a little better factual information reporting by face-to-face, but it's not substantial. And certainly not at the level where it makes a difference, where, you know, yeah, this particular mode that we're doing by telephone, they report unemployment at a rate of 8%. And by face-to-face, it's 8.4%. That may not be systematically large enough for us to worry about because of the nature of the information we're collecting. Maybe it's pretty variable anyway. So measurement-wise, very similar. But there's another problem here, and that is back to the sample, and that's the coverage. Not everybody has phones. Now, we should acknowledge not everybody has a household. And in populations, there are people who don't live in houses. They live in institutions. And it depends on the country as to the nature of these institutions. And most of these surveys that people are concerned about don't attempt to interview people in institutions and mix that in with household surveys. They do those separately. And it's mainly because the institutional surveys are more expensive. For example, an example of an institution would be people living in a long-term healthcare facility, a nursing home, a hospital for care of people who have certain kinds of communicable that are very long-term and take a long time to heal, and you try to remove them out of the population, so you don't leave them in their households. In those cases, institutions like that are difficult to get into. You got to have the disease. It's difficult to get out, so it becomes expensive, more expensive than knocking on someone's door, finding them at home. It's more and getting permission from the gatekeepers, the people who maintain the institution. Another example of people who are in prison or in jail. Okay, you're not going to get them in the household surveys, and there in those institutions, it's actually more difficult to get in than probably to get out. Having done this kind of work, trying to get permission to go in and interview people whom you don't know, and they don't know who you are, the gatekeepers, makes it expensive to do. So they're usually excluded in the face-to-face household survey environment anyway. So there's a coverage problem anyway there, that we're not covering all the population. There are some households that we can't locate readily in remote areas, or we can't afford to get to them. In a country that is an island-based country, in the Pacific region, for example, there may be islands with population. It's just too expensive for us to get there. They have a very small share of the population. So there are always those problems there. What about on the telephone? Telephone is interesting because in some ways it relaxes the coverage error of some types. So if you had a population spread across islands, you might be able to reach people on islands whom you ordinarily wouldn't visit face-to-face and interview them by telephone. On the other hand, there are people who do not have telephones. It used to be a larger problem when telephone service was provided over what's called a landline, hardwired into the house. A wire actually runs into the household, and then there's a phone and a subscription to the phone service there. There were far fewer households that had that kind of coverage, and so that's what we worry about. But with mobile phones, in the North American context, sometimes these are called cell phones. In that framework, they provide today coverage that is in some ways rivaling that you can get with household surveys. They don't cover exactly the same populations. They're slightly different mixes, but telephone coverage has increased dramatically as cell phones, prepaid plans, all sorts of plans have come into line, so that you can access a very high proportion of the population by telephone in many countries, not all. In some countries today, you can access a larger share of the population, the household population, by telephone than you could 10 years ago, dramatically, because cell phones or mobile phones are more readily available and accessible. And a landline phone requires special wiring extra cost to install. And that kept those kinds of phones away from people who didn't have the income to afford them. And now today with mobile phones, that's much more affordable. So the coverage is a big issue that needs to be looked at carefully. And that's another thing that people worry about. So measurement and coverage are two of these important issues. There's one more that I'll mention, and that is what we call in the survey realm non-response. So once you have someone that you sampled their household and you go and knock on the door, that doesn't mean that you're going to get an interview. And these organizations work very hard to get interviews with every one of those sample households, because households typically are sampled very carefully. You can't afford to throw them away or arbitrarily substitute for them. You're looking at something that has been selected carefully as a part of a larger scheme for representing the whole population. And throwing away bits and pieces of it because you can't get interviews, that leads to problems, mistakes, errors, where we interview only the people who are most conveniently interviewed and are willing to talk to us first thing. They tend to be different than the people whom we're not getting in those cases in the sample. So this is the non-response problem. We know the sample, this household's been selected. We know where it's located. We're going there, but we can't get the interview. On the telephone, this is more difficult. One reason why the face-to-face interviews have been so successful and maintained for so long has been that the response rates in many countries in these face-to-face surveys are fairly high, 90% or higher. And that's considered good, 95%. That's like getting 19 out of every 20. When you ask people who've got no prior contact with you to do an interview with you, it's quite remarkable, actually. When they go to telephone, the response rates fall. Calling people on the phone, people are more reluctant to participate. It's not the same thing as measurement error. They're more reluctant to participate for a variety of reasons. They're unsure because it's only a voice. They're not sure if you're collecting information that could be used for them. They have no visual authentication, a name badge. Maybe they'll get a letter in advance in some organizations where they've got address attached to telephones and they can get the information to a subject household so that they realize this is an authentic, legitimate enterprise of a government or a non-government organization or whatever it might be. But the non-response rates are higher by telephone. I hesitate to use absolutes, but I'm saying almost always from our point of view, and by dramatic levels. So you may see a survey that's being done face-to-face with 95% response rates, and response rates might fall to 80, 70, 60%. That gives an organization hesitation, because now they begin to worry if there are differences between those who respond and do not respond. And that can lead to error, because we're not getting everybody into the sample because of this non-response problem. Is the data worse? Remarkably here, in studies that have compared respondents and non-respondents in different ways, what's been found is that for certain kinds of surveys, the difference between respondents and non-respondents is virtually zero. There's no difference. Now, this has been found in surveys on attitudinal items, your opinion about things, that the people who will answer by telephone attitudinal questions are very much giving you the same answers on average, collectively, as people who don't. The opinions of the other people. No one's quite sure how this works. There's theories out there, and there's some very smart people who have very good theories about it, and these things are being tested. But in those cases, people are being very careful when they've had to make this change. So now COVID-19, places that haven't had to do this change are faced with it. They're worried about coverage. They're worried about non-response. They're worried about measurement. And people who have done this in the past have accepted the differences that are there and find that the data that they're collecting is adequate for their purposes. Otherwise, they wouldn't be doing it. So there's a lot of telephone interviewing done through telephone sampling of households, for example, to maintain the parallel with the face-to-face surveys that they're looking at. So will there be differences between if you've been doing it face-to-face and now you're going to do it by telephone? You've been doing some kind of sample selection that gets you households from all the households in the country, as opposed to a telephone sampling that may not cover some households that do not have telephones. If there are differences in measurement error, there are differences in non-response. After you take all that into account, how bad is it? It's there. I won't give you a general answer. It depends. It depends on the circumstance. Many organizations, though, for many years, have accepted that the telephone is a suitable data collection method and gives them adequate data. Now, in an emergency like today, organizations are not going to have much choice. And the most important thing they can do is look at these three issues: coverage, non-response, and measurement, and try to understand them in the context. Compare what they had to what they're getting. I don't know of another way to do it. But that's my response to the general question you've asked. You know, these are the issues that I think people are asking about. They may not say them in the same way I've said them, but the issues are basically around these.
Thank you for this general response about the three major potential issues about the switch from face-to-face to telephone surveys. Speaking of sampling, we have a question about RDDs. Can you elaborate on the use of random digit dialing for telephone surveys?
So RDD, as it's called, I know that, don't know if that comes across clearly on the audio. Random digit dialing. It refers to an era we don't live in anymore. Well, the random part does, but the dialing. So we don't dial telephone. I don't know. Maybe in some countries there's still those phones with the rotary dials. Someone has one. There you go. Okay. But in many countries it's digital, right? And if it's a cell phone or a mobile phone, then there aren't dials on. I've not seen a cell phone with a dial on. I saw maybe a joke picture of a cell phone, you know, a mobile phone with a dial on it, but I've never seen one that you could buy. If they were available, my mother would have bought one, because she lived in that era where you call on the phone and you dial. You don't push buttons. Okay, she would have gotten a mobile phone earlier if it had had dials on it. But nonetheless, random digit dialing. Well, how do you random digit things on a dial? Well, the basic idea is that we can generate numbers at random and then use those for the dialing sequence. We imagine what the world of all the telephone numbers are in a country, what they are. And we know certain portions of the telephone numbers that are part of the system. We know, for example, in I have to be very provincial and take the United States, our telephone numbering system has 10 digits. As a matter of fact, this 10-digit sequence that we have in the United States was a plan that was started in 1947, following World War II, and was for all of North America. And so Mexico and Canada and the United States, and we're three very close neighbors, would all have the same dialing system. The Caribbean, parts of the Pacific, because parts of the United States go way out into the Pacific in terms of territory, well, the state as well as territories. It goes a long way north, you know, to the Arctic regions. So what happens in a system like that is that you actually know the first 6 digits of those 10 are assigned by the telephone system. They're not randomly determined. And we know this. I live in an area where my area code, the first 3 digits is 734. And within that, there are sets of the next 3 digits. They don't use all 1,000 numbers of those 3 digits. They used a subset. It's because of the way the phone system was structured years ago and the equipment they had to buy. They couldn't afford to dial any number that you could randomly generate. But the last 4 digits are typically not known to us. We don't know who, even though we might have an area code and those next 3 digits, the first 6 digits, we can buy that information very cheaply from a government agency that assigns these numbers to telephone companies. And then what we do is randomly generate the next 4 digits and start calling. That's what that means. And it used to be that you would dial them. Today, you know, it's more of the digit punching that we do on the phone. Okay. So random digit dialing today, it depends on the country and the circumstance. The random digit dialing schemes that were used 40, 50 years ago no longer apply because those were days in many countries where the telephone coverage was largely landline. And the number system was structured differently. Not just the first United States, but the 4-digit suffixes, they're called, were structured in ways that depended on electromechanical switching systems and limited which of those numbers were actually being used. But you didn't know exactly which ones, but you knew there was a subset there. Today, that's less true, and especially with things like mobile phones. They never depended on dialing. They never depended on electromechanical. They're purely electronic systems. And so the numbers that you would get in those 4 digits are randomly scattered. So what you do is you buy the first 6 digits, the sets of them. You generate 4-digit numbers, and those 4-digit numbers that you're getting depends on the country, depends on the circumstance, could be anywhere from 40 to 60% of them, maybe more, maybe less, are actually numbers connected to phones that somebody's paying for a subscription. Now, they may not all be households. Some could be businesses. Some could be used for security purposes, government agencies, all sorts of things. But nonetheless, the dialing system then is that random digit dialing that it's modeled after that. And that's basically how these samples are done today. There are a lot of details that we don't have time to go into, but that random digit dialing is how they're doing it. When you get that call, there's some element in which somebody has worked with the system enough to know what the first digits of the phone number are going to be, and then they're randomly generating the remaining numbers. It's like we have a huge virtual array of all the possible telephone numbers that could be there. And that's got certain fixed information at the beginning of the number, but the remainder, we don't know what those numbers are typically. Some countries do, but that's very unusual. And so we randomly generate them in that case. And that leads to some inefficiencies. You know, if half the numbers are connected to subscribers, that sounds pretty good, except it means half are not, and you got to call them. You don't know that they're not connected. And when you call them, most of those numbers are not connected to any kind of machine that tells you this number is not in service. Most of them are not connected to anything except a ringing machine, a ringing tone. And so it drives up the cost of working with them. But that kind of thing, you know, for RDD sampling, that kind of thing for telephone surveys is feasible. And there are commercial companies that help in this process. Now, a government agency may find that uncomfortable because of confidentiality concerns. They don't want to be buying phone numbers from a company that then knows who they're calling or what numbers they're calling. So there can be problems there. But nonetheless, there are commercial companies that collect this information for 100, 150 countries around the world, and then can generate these numbers using these kinds of systems. So it's become commercially viable and more efficient as time's gone on.
Thank you very much. We have a specific question, a rather...
Can I just add some question on to clarify the kind of a jargon or the terminology used for telephone surveys? Because the telephone sampling telephone surveys and the telephone interviews are not necessarily meaning the same thing for a unique survey. And especially in the last days, they may be used instead of each other, or the things are kind of mixing minds of the people even they are dealing. So Jim, could you be more specific to determine what are telephone surveys, what is telephone sampling, and what is telephone interviews?
Mm-hmm.
And I believe that this will kind of give a more clear picture about this, even the terminology, but also the type of these surveys.
Yeah. And I think, Sunan, you've identified the three major terms: telephone surveys, telephone sampling, telephone interviewing. Telephone sampling and telephone interviewing are processes, if I could use that term. They're procedures that people use. The first one is how you get to the households. How do you select the households, which are identified through a phone number, or the people identified through a phone number? How do you do that? That's the telephone sampling realm. What that process is, which could involve the RDD, the random digit dialing, can involve doing is what happens when somebody answers the phone, where you've got to talk to those individuals and convince them to participate in the survey, begin asking them questions, listening to their answers, recording the answers. And that part is using the telephone. The sampling doesn't necessarily use the telephone. It uses information about the telephone system to generate the locations, the phone numbers. Overarching those two terms is telephone surveys. Telephone surveys would involve operations that have both telephone sampling and telephone interviewing. However, there are surveys that only use telephone interviewing. They've already got addresses or they've got telephone numbers from a prior contact. And this is something that a lot of countries have been asking about. They've had prior contact with households. They often do surveys where they go back to a sample of households, what we would call a panel. So they've interviewed them, and before they leave, they say, we'll be coming back, next month to do data collection. And they go back to do data collection. Again, because there's an efficiency in that, but there's also some things happen statistically that you get better quality data on measuring change that way, from time 1 to time 2, from 2019 to 2020, and so on. That prior operation, many times they've collected a phone number. They've talked to people whom they've interviewed in person, and they've got a phone number for them. And so they want to call the phone number back. They don't need a telephone sample. They've already got the sample and the information, so they're basically doing telephone interviewing. And you see that in many of these surveys. But many people would call it then, what do you call that kind of thing? Well, it's kind of a face-to-face telephone survey. But some people will say, well, it's a telephone survey. You're using the telephone for data collection. And they mix the terms survey and interviewing together. They don't make a clear distinction. There's a related term there too, and that is questionnaire. I hear many people say a telephone survey, and what they mean is that set of questions that you're asking. And other people will say, no, we'll call that a questionnaire because that's now specific, because a survey could be used in several different ways, and it gets confusing. But I think in this case, those are the terms. There's surveys over the top, but there's a sampling operation and there's a data collection operation. A sampling operation and an interviewing operation that involves measurement is a part of that, done on the telephone.
Our next question is about a survey from the US. We were wondering how the pandemic affected the survey of consumer attitudes when the pandemic started. Like, anything happened in terms of response rates or any other effects?
Yeah, the survey of consumer attitudes is a good example of a telephone survey. It is one that involves selecting households across the country by telephone numbers, random digit dialing, you could use that general term, RDD sampling method, and then telephone interviewing. And that's been going on that way for a long time. That's a survey that started 70 years ago, face-to-face interviewing. And then they moved to telephone interviewing in the 1970s. So they went through this transition that we're talking about now in the 1970s. And they continue to interview by phone. And today they're mainly interviewing people by mobile phones, what we call cell phones. So it's called a cell phone survey, if you'd like. And we only sample from telephone numbers that we know to be cell numbers, mobile numbers. And then the interviewing is conducted from a centralized computer-assisted telephone interviewing facility. It is a survey that's done every month, and it's used to monitor a part of the U.S. economy that we usually don't think about. And that is, except it's a key part of the U.S. economy, and that is consumers. A lot of the U.S. economy is driven by people buying things, not companies, but individual buying. And so why not understand their views about the economy, how they think it's going, because they're the ones who are going to make purchase decisions. And they may hold back if they think the economy is not doing well, or they may be buying something they've been thinking about buying for a long time if the economy is going better. Okay, so it asks them attitudinal questions about the economy. What do you think? How is the economy going? I'm being very, you can look this one up and see the questions. They're out there for people to see. But I'm being very casual, I think, about the questions, but it's basically that kind of thing. And they take these questions that they ask and develop a score for the population that says, this is the score for the US population in terms of their attitude about the economy. Now, the score level doesn't really matter. It was originally scaled so that, I can't remember when, it was a score of 100, was kind of the starting point. And it goes up and down. And what matters is the change. They're measuring the change. So do persons' attitudes change about the economy? Now, why are they interested in that? Because it turns out that as attitudes change, the economy follows. It's really strange, isn't it? To think that the economy is being driven by people's opinion about the economy. Not exactly that way, but it's an indicator. It's what's called a leading indicator. If you find out that people's attitudes are going down, they're getting more and more pessimistic about the economy, within months, the economy, the other measures of economic activity begin to decline. Boy, it's great to have something like that, isn't it? And companies pay for that. They want to have that information. It's built into economic models. Okay, so this is what we're referring to. That particular survey being done monthly and being done with cell phones, they're out there right now. They're making phone calls this very moment, trying to reach households. They do this every month, day by day. And so they're out there in the middle of it. Generally, I think the concern about the survey is not so much about telephone. The response rates are low, very, very low, because they've had to restrict how much work they can put into calling numbers, but that hasn't changed dramatically. There's no fall off we can see that's, as I understand it, related to the COVID-19, the coronavirus pandemic. Are people answering questions differently? That's where they're concerned. They're not quite sure, because these are attitudes. And so they're monitoring this very carefully, but it's very difficult to tell because the economy is very volatile. Okay, you mentioned my title. I'm retired, and so how do I live? Well, in the U.S., I don't get a pension. I don't get a government salary. Well, I get Social Security, a part of it. It's not very large enough to really live on. I have investments. That's what a lot of American people do. They buy things in the stock market or in bond markets or other things, and those things will go up or down depending on the economy. And there's a lot of volatility in it right now. One day the stock index is up. The next day it takes a plunge. Next day it's back up. It's going, a lot of variability, and it makes people nervous. And what they're seeing in the attitudes is a lot of variability in the attitudes too. There's a lot of volatility because people are uncertain about the economy. That, I don't know if that's a measurement issue or just a real attitude economy But those are the things that they're worried about. Oh, and you throw on top of it an election that is itself very, very volatile. A lot of things happening. And you add on top of that the issues that we're having with respect to race and policing in the US. It's a very uncertain time. And people are answering potentially uncertainly. And so they're watching the data very carefully because they're trying to measure something that is itself volatile. That's what they worry about. So COVID-19 it's not unaffected by it, but it's not so much that it's changed the quality of the responses as much as it's changed the nature of the responses. They're worried that this may be more variable and they're not getting as good a measure as they used to. But they don't have definitive data on it because this is, they've been collecting for 70 years and they've only been doing this a couple of months with this going on. It's hard to tell.
Has the survey of consumer attitudes switched to decentralized CATI with the pandemic?
No, they haven't. They've discussed the issue because the organization that runs it, I'm at the University of Michigan in the United States, and we have a survey center at the university, and that survey center has a centralized telephone interviewing facility. And they use that for the calling. And it goes out nationally. It goes out across the country, but they don't distribute that to another set of interviews we have who are interviewing for other studies that we do. There's only one of maybe 100, 125 studies we do a year. And the interviewers involved in some of those other studies are around the country. They're not in a centralized facility. And we could ask them to make these calls, but they haven't done it that way. Some other studies have, but this one hasn't. So they've stayed with the centralized operation for the time being.
I see. That was actually our next question. We were wondering if there were any major issues regarding decentralized CATI, because we've seen some webinars, etc., where people had to switch to this because they did not want to risk their interviewers working in the same environment. So that's what they did. We were wondering if there were any drawbacks of this.
Well, with respect to the survey of consumer attitudes, just to continue on with that one, they made the switch to centralized telephone interviewing decades ago, in the 1970s. And when they did that, they were concerned about the interviewing staff in the field because they were taking away part of their work. Now, they had other work to do for other studies. It turned out not to be a major problem for them. But when you've got an organization that is largely doing face-to-face interviewing and you stop them, they're going to find other work. Now, maybe the stopping is because of restrictions. You can't go out and do interviewing. It's not allowed by government policy, either national or regional or state policy. So they have to stop. But if you also make it so that they stop because you've moved their interviewing to the capital city in a room with lots of telephones in it, you lose them. They're going to find other things. And so you worry about that. They're part of the infrastructure for other studies. And if you go back, you got to start all over again if you've lost them. So part of the issue for centralized CATI systems is a consideration in this era of we've got to staff out there. It's not only the interviewers, field representatives, it's the supervisors, the people who monitor their work, who give them their assignments, who check the quality of their work. All of that kind of thing is an infrastructure. And so decentralized CATI in a transition from decentralized to centralized, or staying decentralized for keeping the interviewers busy by having them call by telephone from their own homes is the issue. Now, a centralized system has a few potential advantages because you can be doing an interview and the supervisor can listen to what you're doing, watch it, and make sure that you're using the right kinds of techniques, that they can advise you on dealing with particular problems in real time. Whereas decentralized, that's very difficult to do.
So thank you for that. We have a slightly different topic to ask you now. So we've talked about telephones, and we also want to ask you about online surveys, which, as you indicated before, is a very wide subject. So what we want to ask you is coverage issues regarding online surveys. We know there are different types of online surveys out there. There are some that recruit people through postal services or like emails. There are also ways of recruiting people through social media, advertising, etc. There are so many options out there, but what should researchers mostly consider in terms of coverage issues when doing online surveys, basically?
There's a whole lot of stuff out there in terms of what online means. Typically, though, what we're meaning by it is it's self-administered on a computer screen so that when you enter the data in, it's entered in and it's right there in the system. It doesn't have to be converted from paper. It's transmitted right away to the group collecting the data. They do know who the responses are coming from, right? They don't typically do this in some kind of anonymous way. And so that kind of online data collection has a lot of attractions. Okay, but let me go back to the three issues now: the coverage, the measurement, and the non-response, because they all come into play here with online surveys. And again, it's online sampling, how you draw the sample to get at people so that you can contact them and have them complete a response. And then the online doing, which is typically done, let's say, through a screen like this that we're doing, where they can read a question or hear a question and enter responses. Oh, and that includes phones, right? Mobile phones, smartphones are used for this as well. All right, so where are we on the coverage issue? Well, it really depends on how the samples are done. You'd think, well, I guess can't we draw a sample of email addresses? And that's how we contact people online. We'll just get their email addresses and draw a sample. Unfortunately, we do not have good resources for doing that. The telephone numbers, we can figure out what phone numbers are being used. Remember what I said about national systems. You can figure out what phone numbers people are using. You may not know it exactly, but you can pretty successfully screen from a set of randomly generated numbers. You can't randomly generate email addresses. You can buy email addresses from commercial companies. They collect them. They harvest them off the internet. But then you don't know who they are connected to. You don't even know where those people are. You don't know if they're in the country that you're doing data collection for. You know, we all have this situation now. I mean, people who are their home is in one country, but they're living and working in another country. They're sending money back, or they're living there and their families communicate back and forth. All of these kinds of things. You can't really use those email addresses very well because they have no specific information. You have to contact them and ask, where are you living? That makes it very hard to do, just to use those from that point of view. Plus coverage. The email address list that people have available, these commercial firms, it's not at all clear. I wish I could tell you a number, 80%, 50%. We don't really know. But you can get a lot of phone numbers, and you can email addresses, contact people, but you do not know what the coverage is. And in situations like that, people shrink back from it. I'd rather not have an unknown coverage problem here. And there are other issues with them too. There are email addresses out there that are not used. I have a friend who has 6 email addresses, and he uses one of them for his personal things, and he only gives it to personal friends. Another one he gives to companies that are contacting him. Another one is his business email address. There are all sorts of uses. And so you get this problem that you can get contact with people in multiple ways. Some people, and other people have only one, and other people have none. It poses a real difficult problem for sampling. So what are people doing? So that they can do online data collection. If you can't get through to them through the internet, through some kind of web-like structure, they're using mail systems, which is what you were mentioning. They're literally going and taking the addresses that they can buy or have control of for households, and they're writing them a letter. they're sending them a piece of information by mail and asking them to participate in a survey. And then they ask them, we would like you to do this online. If you're willing to do it, here's the link. Now, the response to that is not always as successful as even the telephone. The people are, again, legitimacy issues. It does come by mail. There are other things that you can do. But it is a bit of a difficult dilemma for people to know how to respond. It's much easier to throw away a piece of paper or recycle a piece of paper that's come to you. Even if it includes an incentive, sometimes they will mail cash inside the envelope as an incentive, encouragement, maybe even a legitimizing feature. This is really important to us and we're willing to send you some money, even though you haven't answered the questions, to get you to participate. Okay. So there are a variety of things that are happening there. But because getting people from the mail to online is difficult, they actually give people multiple options in some cases. A fairly typical one would be mail sampling, mail address sampling. There's sampling addresses that you can send mail to. And then the interviewing is on paper, self-administered. Piece of paper, they send them a questionnaire and ask them to fill it in. Or online questionnaire, where they fill in the questionnaire on their computer screen. And they give them a link. They tell them how to get to the questionnaire. And well, they can also do it by phone, by smartphone. So that's what is going on with online sampling. It's that kind of thing. There's another arm to this that I should mention, especially commercial firms. They are contacting people in advance, oftentimes by mail, sometimes by telephone, and asking them if they'd be willing to participate in future online surveys. And they build a panel of people who are willing to do this, who've told them they're willing to do it. And they collect some background information about them. And then when that commercial firm gets a contact from a government agency, from a private company, from a university that has a survey center, then they sample from the panel, the people they've already pre-selected, and then send them the questionnaire online. Problem with panels is that there's a non-response built into it. People don't join panels. They do. There are millions of people on these panels, but it's not necessarily a carefully selected sample. It's a sample that's on the basis of people deciding whether they want to participate. And there you have that non-response problem. More timely information, that's very attractive, but the quality of the data still matters. And there are serious questions about the quality because of the coverage and the non-response issues. Also, measurement. There are things that we ask in person and by telephone that are very difficult to ask online. We may have ways that interviewers ask questions that are difficult to replicate, duplicate online. So for example, the survey of consumer attitudes has some questions in which they ask people about the economy. And they say, for example, do you think in the next year the economy will get better or get worse? And a respondent may say, oh, it's going to get better, or it's going to get worse. Or they may say, I don't know, it might get better, it might get worse. I think it's maybe a combination of both. Well, that wasn't an option. So then the interviewer is authorized to say, well, would you say that it's going to be about the same? They hadn't given them that response before. So about the same is a legitimate response, but they don't give it to them in the beginning. It's better or it's worse. Now, it turns out that if you ask that question online, how are you going to do that? I mean, they can see the question. You got to have the response. And if you give them about the same answer as an option, more people choose it than they would on the telephone.
Speaking of internet, we also want to ask you about other sources of data available through the internet. So we've seen the number of studies increasing that use data that's been collected, for instance, from Google search data or Twitter hashtags. Especially with the pandemic, we've seen a lot of studies with Google mobility data. So we're seeing different ways this type of information is used to like shed light on human behavior. How do you think studies as such will affect data collection in the future? Will they start serving as a replacement to surveys in some cases, or will they be complementing one another? And are there any pitfalls we should be aware of with the use of such data?
Right. I think your question in some ways has the answers in it, given what we know right now. So yes, using these alternative data sources, there's a generic term referred to this kind of thing as big data, as though these data are in much larger sizes than we're used to, and so it requires special processing and handling. And there's a focus on the computer aspects of managing, manipulating that data in that realm of big data and data science. But will it substitute for what we've been doing by survey? In some cases, yes. It's going to happen that we will find some uses of that data that will be an adequate substitute. But it's going to be an adequate substitute because we've been able to compare it to the survey, right? Because the survey is the standard. The survey has it's not necessarily perfect quality, but we understand a lot about its quality. And when we move to another data source, especially these data sources that are coming from commercial sources like that, whether it's a private company like ABC or Facebook or some other, then that kind of data, its properties are not as well understood. And so we worry about issues, the kinds of errors we were talking about before, coverage and non-response and other things. Measurement, they're translated in different ways, but they're still there. And we don't understand it well. So how do you understand it better? Well, you do that by comparing. That's how we've learned about how well telephone interviewing compares to face-to-face interviewing, comparing the two, and then measuring them and keeping track of what's going on. And so as we move ahead, we're going to find ourselves in a situation where sometimes that data clearly, because it's fast, it's cheap, we get more timely information, we're going to move in that direction. When you look at this realistically, the examples so far of this kind of thing have not been particularly spectacular successes. There were some that indicated, yeah, this could really work, this could really happen. So for example, we've been talking about COVID-19. For years, many countries have had systems in place to use surveys to monitor the level of influenza infection. It's a seasonal infection, and it goes way up in the winter months in a country. If you're in the southern hemisphere, the northern hemisphere, there are different seasons, but nonetheless, it goes way up. And so it has implications for hospitalizations, hospital care, the quality of care, illness, death, the same issues we're dealing with COVID-19, but deaths are much less frequent with influenza, but infection rates are pretty dramatic every time we go through it. And there are vaccines, all those kinds of issues. The same issues that we're dealing with now for coronavirus are there for influenza virus. And influenza was monitored by surveys where you would ask people about symptoms, ongoing surveys where you ask people if face-to-face or by telephone, have you had these symptoms? And you could come up with a fairly reliable and somewhat accurate measurement of the level of influenza infection in a population by asking them about 5 different symptoms, fever, cough, body ache, those kinds of things that we associate with influenza. And they would come up with a measure on a weekly basis of influenza levels in the country. Unfortunately, they were tied into systems that were face-to-face, and they weren't particularly timely. It took time to process the data. So the data would follow weeks, maybe a month later. So someone said, well, let's try something like an online system where the people are doing searches. And they're doing searches around the term flu, F-L-U, or influenza. And so if people start asking online, start doing more searches about this, maybe that's an indication that there are more infections. Could we use that as a substitute? That's kind of an indirect one. We're not asking people directly this question. We're relying on their searches online. We don't know who's making those searches. We know almost nothing about them. But do they move in the same way? So as those online searches move up, are the infection rates moving up? So they would do comparisons. Online searches going up. Ah, look at that. The weekly reports, which are lagged by a month, they're taking more time, but we got this more timely way, they're moving in the same direction. The first times they did it, it worked that way. But on, it turned out that people were using the searches in different ways than anticipated. And the online measure, after 2 years, did not track the same way as the survey measure. It was missing the start. It was going too soon. It was showing up at different times of the year. It was more volatile. And so they continued to try to use it, but it has not been a successful application of using that kind of search information to try and say what's going on in the population. Now, there are lots and lots of other examples where it has similar potential and may very well work well. But you have to be careful here, because you don't want to go to a system that is going to provide you with misleading information and you have no backup. So come to the second part of your question. Will it replace? In some cases, I think yes. Will everything be replaced? No, it's more likely we're going to have complements. There are things you can do in surveys that you can't do with these systems. And these systems need to be calibrated. They need to be measured against another standard that we know how it works. So I think you're going to see those kinds of things happening, where maybe you have that online system, that flu system, using online searches to refined online searches to track disease prevalence or disease increase and decrease in a season. But you may need to constantly measure it against survey data to see that it's still working. Because we already know that in that case, it worked sometime, but it didn't work others. We need to know. We can't afford, since we spend a lot of money in some countries on influenza vaccines, hospitalization, hospital care, all these kinds of things, protection, special protections for older persons who are more prone to these infections. We have to be more careful than that. And so I think you're going to see complementarity among these systems. Surveys may decrease in importance in some cases, but they're going to be there, and surveys will be used to evaluate bias and reliability of these other systems. Now, that's a very brief question, and this is a huge subject. There are millions of people working on these problems, and all sorts of different ways that these kinds of data are being used and tested. So again, I gave you a general answer, so it's wrong. Okay, general answers can always be taken apart, because there are going to be exceptions that disprove the rule. But that's, I hope, a little bit of a framing to think about it in terms of where this may be going. Where it's going to end up, I don't really know. I wish I were 40 years younger and it could be active in the field for the next 40 years, like I've been active in my field for 40, 50 years now. I'd love to see where this is going to go. This, for me, and it's not just an intellectual thing. I have a certain passion. I care about this stuff. And so I'd love to see where it's going to go, and I'd love to be part of that. But back when I started out, I couldn't have predicted where we are from back then. It's unlikely that we're going to go back to the way things were, because we may be anticipating the next pandemic. Who knows when the next animal transmission to human transmission might occur. But we're going to keep this information in our minds, in our systems, so that in case something happens, we've got some background, some way of thinking about what we might do. Would we change? Would we want to move entirely back to face-to-face, for example, where we started out? And it's possible that we would, depending on the circumstance in the country, in terms of the cost and the timeliness of the data. People may find the telephone is a little bit faster, a little more timely, and that may be attractive. Maybe they then start to want to blend these. And this was something that happened when telephone surveys first became more common in Europe and the United States, that you saw a blending of them because the telephone had attraction, but the face-to-face had value as well. And that may be happening as well, may happen as well. But I can imagine a lot of organizations, institutions, if they're struggled to get the telephone survey system working, may welcome the opportunity to go back to what they were familiar with doing and go back to something that they understand better than they do the telephone system. But I think that's an interesting exercise to speculate that way. But I think the more important issue is that this is probably not going away. Right? A vaccine is not going to. This is not. I worked in public health a long time over the years, and started out as a field epidemiologist with a very infectious disease decades ago, and we managed to eradicate that disease. But it's the only one that's ever been eradicated. And we got lots of diseases out there with vaccine. That one had a vaccine, and as a matter of fact, that disease is how the word vaccine came about. But that's another story. It had a much more effective vaccine than anything I've heard people talk about for COVID-19. These will be good things for us to have, these vaccines for COVID-19. And they will reduce transmission and make this a much more manageable situation. But we're still going to need to take a layered approach. There are just things that we're going to need to do to protect ourselves from infection, especially older people, because we know that it strikes much more dramatically there. The death rates are higher, the infection rates are higher. So there are things that we're going to know that we're not going to go backwards on. And that may mean that what we've got to be anticipating is a world in which there are going to be restrictions, or maybe not restrictions, but there will be things that we do differently because of this infection that has not gone away entirely. And we have found ways to live with it through social distancing and other things. And we should anticipate that and begin thinking now about what we're going to do in such a future, where the restrictions are not as severe as some of the things that we've seen, and where we're going to need to manage this and protect our respondents and protect our staff. We're doing data collection and take advantage of things that are more timely, faster, cheaper, but not necessarily have to rely on them because they may be somewhat compromised in quality. And so we may be thinking about, let's run this survey and have a substantial portion of it done by telephone, but keep doing face-to-face interviewing, because that's our benchmark. And I can take what I'm learning on the phone and calibrate it. I can measure it against the face-to-face in such a way that I can get better estimates, because I got a larger sample size by telephone, collect more interviews for the same amount of money because it's less expensive. But I need to make sure that if it's got a bias in it due to non-response or coverage or measurement error problems, I can adjust that from what I know face-to-face and understand. So I think we need to think about those things, how that works. We've had experience with this. We have what are called mixed mode surveys. This is related to an earlier question. You can do telephone interviewing and face-to-face interviewing, two different modes of data collection, and blend them. We've also had dual frame samples or multi-frame samples where you're sampling households by traditional household methods from address lists, and you're sampling households through telephone lists. And you can blend those as well. So I think we may need to examine those and think about whether or not those will provide a way to address this kind of a future.
And as a final question, so what kind of research topics or survey topics do you think are most affected by the pandemic? What kind of data are we most struggling to collect, and we will keep struggling for a while?
Well, surveys collect a range of data. I've mainly been talking about interviewing. So that's what the questions were. But surveys collect data in many other modes. So they collect data by personal examination, physical examination, neurological examinations, tests, things that can't be done by telephone or online, or at least done reliably. We have to think about ways to get these things done and combine them with the other things that we're doing. So that's one set of issues, that there are just topics out there that are going to need to address this in different ways. Besides which, there are research topics about surveys themselves that are going to have to change, because we're changing the methods. And to understand what we know, what little we do know, and we actually know more than in some other fields, but about surveys, about how people answer questions, about how we can collect data, about the quality of the information we're getting. To the extent that we can continue to do research on those topics is important.
Thank you very much for all the time you took for us and all your efforts prior to this interview. Professor Türk Yılmaz, do you have anything specifically you would like to ask?
Yeah, actually we are already having an hour and a half, so it was really fruitful, and the good explanation to all our questions, as usual, from Jim's side. So I'm very thankful, and I appreciate you to answer our questions. And I believe this will be kind of a guidance to the whole people about what's going on, about the surveys, and what is waiting us for the how can I say, it's soon. So I don't know how long will it take that soon, but the people are really wondering, not only for surveys, but for also their social lives, their work lives. But these are all connected, I believe. So that's why the collecting data and the modes or the ways of collecting data is also depending on our social life, as we are doing the social research. So I thank you very much. So, and the appreciation again.